2 of these cases came from the same facility, and 2 of the officers are hospitalized. We've been working diligently with the Department of Assets and Information on extensive cleaning of the districts, particularly the districts where we have experienced people testing positive. Special attention is being paid to common areas, including desks, bathrooms, lockups, break rooms, and processing areas, and other high-traffic areas. Once a sick member is identified, special attention is paid to their workstation, their vehicle, and frequently visited common areas. We're following guidelines from the Chicago Department of Public Health to make sure that these stations are safe and clean. We've also taken additional measures to distance the public from desk officers when they come in to make reports. We are posting signage, and we are requesting that if people have non-emergency needs that can be met by the police department, that they call 311 rather than come into the station, so that they can maintain appropriate social distancing for their own safety and for the safety of the officers that work in the station. In order to keep our officers safe, we have distributed over 12,000 protective gear kits to the districts. Each officer in the field is outfitted with protective gloves and masks. The protective kits were made primarily out of stock on hand in the city's warehouse, but were augmented by the generosity of Ken Griffin and the University of Chicago Crime Lab. We've changed our roll call procedures and our CommStat procedures to limit the size of the group to below 10 and to create distancing. On the enforcement side, since the public health declarations, we have issued 0 citations and 0 arrests for violation of the health orders. We've also seen significant evidence that Chicago is staying home. Our calls for service, radio calls, 911 calls are down 30% during this month. We've also seen a significant reduction in vehicle stops and pedestrian stops by our police officers. All of this indicates to me that people are doing what we ask, that they are staying home, that they are by and large creating good social distance, that our police officers are only focusing on things that have a direct impact on public safety, and making sure that we all get through this together. With that, I'll bring up Commissioner Ford, and he will address the issues with the fire department.
Thank you, Superintendent Beck. Good afternoon. I want to begin by saying that while this pandemic is unlike anything that our city has ever faced, we are prepared. We are ready to provide the service and care the Chicagoans have grown to expect. This unprecedented crisis has caused us to fine-tune how we go to work and do our business as first responders. At the end of the day, I have reiterated to our membership that they have the proper training, they have the proper tools to get through this critical time. As part of that effort, the department has ensured that our firefighters and medics responding to emergency calls have been provided with personal protective equipment, PPE, specially designed to keep them safe during this time. Furthermore, the department will implement training protocols for CFD personnel on how to respond to emergency calls where there is a chance that the disease transmission is possible. As a precaution, these training videos and protocols have been made available across the department for all fire and EMT personnel. We not only protect ourselves when we use our equipment properly, but we protect our families and the public as well. The well-being of our members, in turn, their families, is my ` priority. We currently have 5 members who have tested positive for COVID-19. I am happy to say they're all doing well and being at home. We continue to work to control any exposure while on the job. And as we stress how important it is that our members heed the call to use precautions when it's necessary, we continue to disinfect our equipment and houses, and CFD is monitoring all our members' health safely every day. We have several ambulances that are dedicated to possible COVID-19 cases, in addition to our ambulance fleet properly equipped and following all CDC recommendations on the use of PPE and patient safety. In closing, social distance, following preventive measures, such as frequently hand washing and coughing into tissues, throwing the tissues away, again, by hand washing, combined with well-trained and fully equipped first responders, we'll get through this crisis together. I want to thank our partnership with the Public Health Department, our brothers and sisters in blue, the Chicago Police Department, our dispatchers and call takers at OEMC, as we work in unison to keep each other safe. I also want to thank and acknowledge the mayor for visiting one of our firehouses this morning and having an open and frank conversation with our members, making it very clear that the city will do whatever has to be done to keep supplies stocked and our members safe. Thank you. Now I'd like to introduce Chicago's leading public health expert, Chicago Department of Public Health, Dr. Allison Arwady.
Thank you to both of you for really the incredible partnership and work, as we've been really making sure that together we are keeping Chicago's first responders safe. We are absolutely prioritizing healthcare workers and first responders as we're making sure they are getting the personal protective equipment that they need, the appropriate information, the right training. The safest place for anybody to be related to coronavirus is at home. And I want to thank the great majority of Chicagoans who are abiding by that stay-at-home order. But we know that there are essential workers who need to continue to work. Right up front on those are our first responders. And because they can't stay home, it's important that we are prioritizing their safety. And I want you to know in all the ways that you've just heard, that we've been working on that together. We have a plan, we're prepared. I've never been more pleased to have stockpiles on hand, to know that we will be able to continue to support the needs of our first responders and of our healthcare workers, even as we work to build those stocks, recognizing that the global supply chains have been disrupted in a lot of ways. But I really want to thank, first and foremost, the first responders who work every day around the clock to keep us safe and who now continue to work to keep us safe. It is one of the health department's top priorities to keep you healthy and safe during this pandemic. Let's talk quickly again about the risks of transmission for COVID-19. We have a very comprehensive website. Anybody who's not visited yet, chicago.gov/coronavirus. I sat down with Superintendent Beck the other day. We taped a number of questions from Chicago Police Department officers. We will continue answering questions. But I know that there are still a lot of questions out there. I know that people are worried. I know that people are getting a lot of information from sources, and I know there's a lot of misinformation out there too. I want to remind people of the basics. This is a new virus, so we continue to learn more about it every day. But here's what we do know. Based on both information around the world and what we've seen here in Chicago, the main risk for transmitting disease is among people who have close contact. You've probably heard me talking about the way that we define that, at least 10 minutes of being within 6 feet. And that has to do with the main way that the virus spreads. When someone is coughing or sneezing with coronavirus, the droplets from their cough and sneeze can get onto another person directly or through hand contact. So the recommendations that we're giving about frequent hand washing are meant to say that if you have been in touch with coronavirus, before you're touching your eyes, your nose, your mouth, you wash your hands, you will not then transmit coronavirus into yourself. When we look at some of the investigations that we've done here locally, because I know it's easy to sort of say, okay, mostly this is about close contact, but what does that mean for me? I want to highlight a couple of the early cases that we had the resources to do major investigations on. Way back, our first case, back in January, we looked at hundreds of people who were in contact with that individual. We looked at healthcare workers. We looked at people in the community. We tested. We followed hundreds of people, and we saw one case of transmission between the husband and the wife, as you'll recall. Similar with those next cases, husband and wife. And then early on here in Chicago, people may recall we had this situation at a school, not just any school, but a school for special needs children, a lot of very medically fragile children, exactly the situation where you do not want to see coronavirus. And we had a teacher's aide who was diagnosed with coronavirus, who was in the school and working during the time that she was symptomatic. This was before it was known that she had coronavirus, so this was an issue. It wasn't that she was doing anything wrong, but she potentially exposed a lot of vulnerable children. In that setting, we quarantined the whole school. We brought everybody home. We followed hundreds of children, hundreds of staff, anybody who was in that building. The index case, that first teacher's aide, did transmit coronavirus. She transmitted it to family members with the close contact. We did not see any sign of transmission within that school to the students, to the teachers, to the other folks who had been there. And that is consistent. Those examples where early on we do have more resources to follow hundreds of people, that's consistent with what we've seen around the world. Coronavirus, on average, one person with coronavirus spreads to between 2 and 3 other people. If you don't have vaccination, and if you don't have social distancing, if you don't have these things in place. It is not like the measles, to be clear. I've worked on measles outbreaks, including here in Cook County. Measles is a disease that is airborne, that we worry about if you've just been in the same room as somebody with measles. There's a very high chance that you will catch it. I did a measles outbreak in a daycare here in the Cook County area, and we don't start vaccinating for measles until age 1. We expected that probably all of the children under age 1 would get the measles, and in fact, all but 1 did. Because measles is so easily transmittable, one person can transmit to 18 people. It is broadly in the air. So this is not measles, that's good news. It's also not Ebola. So I worked on Ebola outbreaks. Ebola is, first of all, has a much higher mortality rate, that really 1 in 2 people who are infected with Ebola die. But also, the potential for Ebola spread is even from small breaks in the skin and the potential for touching people and having the virus get in, not just through the regular respiratory pathways, but through these other ways. And so some of the moon suits and some of the very aggressive personal protective equipment that folks around the world were needing to wear, and even our first responders were needing to wear, where we were following potential Ebola patients and very aggressive special containment measures. That was because of how that virus spreads. This is not Ebola. Based on what we know about coronavirus, this spreads like the flu. We know that it has more potential for spread than flu because nobody is immune to it. We do not have a vaccine. There's also some evidence that people can transmit the disease earlier in illness. So one of the strong messages that we've been giving, from the beginning, stay home if you're sick. And really, we've put a finer point on that. Stay home if you're even beginning to feel sick. First responders, healthcare workers, we're really used to toughing it out. You start to feel sick, you get a cough, you're not feeling great, and you say, let me work for 2 or 3 days. And then when my fever's really high, my cough's really bad, that's when I'll stay home. Because there is more potential for potentially spreading the virus early, we put in order here in Chicago by law that people, including the essential workers and the first responders, need to be staying home if they're feeling sick. But if they're not feeling sick, we need them to continue to work. We count on them. We will be providing the personal protective equipment, making sure people are using it appropriately. Sometimes if people are using personal protective equipment not in the right way, that can have actually other risks associated with it, and that's why the training's so important. Last week alone, the Chicago Department of Public Health put out more than 220,000 masks to our hospitals. We put out thousands to our first responders. We put out gloves. We put out other material where it was needed in other settings. We have personal protective equipment. We want to make sure people are using it appropriately. We're working to have even more because everybody's been hearing the stories. But by and large, I want folks to really thank our first responders, and all of the other essential workers who are stepping up and continuing to work at a time where most of us are staying home. With that, I think we'll stop and turn it back over and see what questions people have.
Go ahead. So for CPD, we have 12,000 that we've distributed over the last week. 13,600, but many are in non-field assignment. Well, I'd be interested in the timing on these conversations with you, because I've been to 8 districts in the last couple of days, and all of them have PPE. I personally inspected them to make sure that my directions were being followed. You know, one of the reasons that we shut down the academy was to have recruits put together PPE kits, and they are literally putting together thousands a day. So that should all be rectified, you know, and we are doing our absolute best to make sure that these police officers, who, believe me, mean a lot to me personally, are protected. And, you know, I appreciate any of our fire department brothers that gave us some equipment, but the police officers have that now. However, I will say that it is always important to recognize what level of equipment you need, and Dr. Awadi can talk about that, and one of the things we did in the video that she and I did together was explain to police officers when you need what type of protective equipment, because, as she said, this disease is different than measles. It's different than airborne. You know, there are certain things you need and certain things that frankly you don't. Well, you know, I think that police officers are impacted by what's going on around them in their homes and in their city. And all of them that I've spoken to and everything that I see tells me that they completely understand the shift in responsibility. You know, when I told them that I didn't want them writing citations or moving or parking citations for things that weren't directly public safety related, you know, equipment violations and the like, they complied. When we said, look, if you have a certain level of misdemeanor arrests, cite them out. Don't bring them to the station. Don't put them into the system. Cite them out if they're likely to reappear and they meet the criteria. And they've done that. Our traffic stops are way down. And normally, as a chief, that would upset me. But in this case, it tells me they are doing exactly what we're asking them. And when I tell you that the calls for service, the 911 calls to dispatch, are down by 30%, that is huge, huge. You know, we normally get up to 10,000 a day, and we are down significantly. And so that tells me that the city of Chicago is doing the right thing and that they are staying home and not being out on the street. And so, and I know that all of you drive around, and I know that everybody listening to this drives around, and we all see that people are adhering to this. Now, not everybody. You know, we still have to do warnings, and we do, about distancing, about grouping, about keeping businesses closed. But by and large, this city is doing the right thing. And I think that, you know, we can concentrate on the negative all we want, and I know that that's the newspaper's business and the media's business, but I would like to state the positive. You know, I see a city that is reacting appropriately, and I think we will be much better for it in the long run. So to the first question, yes, there are protocols for that. If somebody is sick, first of all, if they're in custody, Cook County won't take them without an evaluation by a doctor. So they go to local emergency hospital and they are evaluated, and they are either determined to be okay to book in the county system or our system, or they are mandated to be booked in a medical facility, and then we would monitor them. And then we have protocols. After that happens, we've told the officers to clean their cars, if in extreme cases to air them out for several hours. This is also one of the pieces that Dr. Arwadi and I talked about in our frequently asked questions and in our messages to should be commonly known. And the second question was what again? Oh, the lobbies. So you know, what you're talking about is folks that are homeless staying in one or two of the stations when the weather is inclement. And so what we have done is we have worked with Chicago Housing Authority to have a response to make sure that we can get those people into a facility for long-term housing. And if one of the things we talked about in my daily meetings with senior staff today was to direct that if folks had people congregate in the lobby because they had no place to go, to make the appropriate contacts within the city family, and the city family would find them a place to go. So, and then we've done some other things to create some social distancing in the lobbies. Although I will tell you this, you know, there are many people besides police and fire and medical personnel that deal with the public every day in their day-to-day lives, whether you're working at the grocery store or you're in an auto repair industry or whatever it is that you do. You know, everybody is in the same predicament here. We all have to be careful about what we do, be careful about our contacts as well as we can be, but go on with our lives also. Well, I'll give the short answer, but I think that obviously Dr. Wadi is much more qualified to answer than I. But the criteria is if you feel sick, if you have symptoms, stay home. If you feel well, if you don't have symptoms, then come to work, but constantly monitor yourself.
Yeah, and I would just add to this. So this starts getting into what is close contact and where does that fall out. And so broadly speaking, when people are being diagnosed with coronavirus, and you know, let's be honest, increasingly we are all going to know someone, be in contact with people who have been infected with coronavirus. That's what happens here. We're looking at really risk factors. And so if it is someone in your household, in your family who is diagnosed, like not a second cousin, not someone who was at work, someone in your household, then we are recommending that household do stay home and self-monitor for symptoms. Other than that, if it is not someone in the household setting or someone with otherwise very close contact or a high-risk exposure, the recommendation is that they continue to self-monitor. If they have any symptoms at all, we don't want them in. And so to make this a little bit concrete, maybe we'll talk about, for example, when there was a case in the Chicago Fire Department early on, and we really looked at this and said, you know, what needs to happen in this case? Does this person have any household contacts? If so, those folks should stay home. And then secondly, there was a partner who had been working in very close proximity, intubating people together, for example, really working very closely during the time that the person had symptoms, and we suggested that that individual also stay home. When you quarantine someone, it does not keep them from getting the disease, but it helps prevent further spread. But in the rest of the firehouse, there is not an indication for people who have been broadly in the space, who've not been having that close contact. We did a thorough cleaning, and we encouraged everyone to self-monitor closely if you think that you may have been exposed, and if you develop any symptoms, to stay home. But that is the same advice sort of to the world at large, that anybody who's developing symptoms, we want people home.
Add to that, and one thing that we put in place for our employees is that our medical section is open 24/7, 365. They're in close contact with the Department of Health, And if a member, a police officer, has a specific question, exactly as you put forth, that's who they should contact. And we will make an assessment there. You know, we have taken precautions when family members are sick. One of the members who has been diagnosed with COVID-19 has two children who are also members of the Chicago Police Department who live with that individual, and they've been directed to stay home because they have such close contact. So everything is a individual case when it's that close of a contact.
So this is where we get into this close contact piece. I think, you know, increasingly, as we have more and more cases, the main role and the main advice that comes is primarily about those household or other close contacts. And so that's where, you know, as you said, for these groups reaching to the medical officers, and then Chicago Department of Public Health is in touch there where there are questions. So we are not doing the very large-scale, hundreds of people investigations like we did early on, where we had a handful of cases. If there were settings where we had very vulnerable individuals, right? So kind of with that, the school that I talked about, that was a school, first it was early, but secondly it was a school where you would really have a high concern. That's why we went in as strongly as we did. Certainly where we see cases in nursing homes, for example, where we see cases in settings where people are living very closely together, we are absolutely doing big investigations and really making sure that we're understanding spread and following folks. Certainly in our homeless population, for example, if we have anybody who, you know, we're doing a lot there, recognizing vulnerable populations. But for people who are at work, who are not necessarily living in these congregate type settings, we're really giving the advice about the close contact people staying home, but everybody at this point, you know, doing self-monitoring. Like, it doesn't matter if you think you were in contact with somebody, you don't think you were in contact with somebody. As we continue to see more cases, everybody is really self-monitoring. And if you are developing symptoms, you're even starting to feel sick, please stay home. It's been the advice from the beginning. It gets even more important as we see more cases. Everybody should be home all the time, but even those essential workers. I start feeling sick, you won't see me out until I know that I'm better.
So just to be crystal,
Yes.
police officers and firefighters.
Yeah, we should not close either of those. These are absolutely essential services in the way that we cannot close hospitals, right? We do the same work with our healthcare workers, and we do an assessment when someone's been diagnosed with coronavirus. We work to make sure the people who were the healthcare workers in very close contact, were they wearing appropriate personal protective equipment? If we have people who had close contact and were not wearing the personal protective equipment, we may have some of those furlough and not work for some time to follow them. Everybody else at this point is under the monitoring, and it's the real strict, you know, not coming to work. We're obviously working to make sure people have personal protective equipment too. But we cannot close fire stations. We cannot close police stations. We are making sure we have all the appropriate cleaning protocols in place. Those have been stepped up. If people are diagnosed and people across the city, we're going to continue to be seeing cases diagnosed. The most important thing is that individual, their household contacts are staying home, other close contacts in this way that I've been describing. And other than that, we need people monitoring themselves for symptoms and then doing all of the things. If, you know, when you're at work and you're doing that social distancing and you're doing your hand washing, and then where there are needs to come into that close contact that our first responders may have, they're using personal protective equipment, that will be protective for them. And we need people to continue the really important work of responding to people in need here in Chicago and keeping us all safe.
You know, I'm not going to do that. First of all, I don't have it right here, but we have. I'll give you what I remember anecdotally. A couple of detectives and some patrol folks, and one that works community relations position. I will add that every one of them I have talked to personally. I've called them, checked on their well-being, checked on their family. All of them are in great spirits and tremendous people. They're very, very brave. They want to get through this and get back to work, every one of them. Well, you know, we have significantly more resources in the field right now than we would normally have. We have put the entire Chicago Police Department in uniform. We have taken some of our headquarters people and moved them into the districts. We have our recruits manning non-law enforcement positions in the districts and in headquarters. And we are using some of those resources to make sure that some places that we think may be impacted by this are safe. Some of those are our commercial corridors, some of those are our food stores, and also some of our financial institutions. And so far, as I said earlier, the city of Chicago has reacted splendidly. The city of Chicago and its people have been absolutely top-notch in this. You know, we have seen a decrease in crime, particularly violent crime. We have seen a decrease in calls for service, and you know, we have seen a accompanying decrease in our citations and our low-level arrests. So I think, all in all, you know, things in that vein, things are going well. Now, you know, obviously this is something I look at every day, and my job, of course, is to prepare for the worst. So, you know, we do that. Well, we broke up a number of them this past weekend, you know, not a huge number, but a number. And, you know, my advice or my direction to them is that we use first education, then warning, and then we warn again. And then, if need be, you call a supervisor to the scene, and they will make the assessment. The bottom line is that we don't want to arrest people for doing things that before last week would have been legal, unless we absolutely have to, and unless we are sure that they understand the severity of the violation that they're committing. And so far, people have been good about that. Now, will that continue? You know, we will see, but I know that Chicago PD is ready for that. You know, we have never had an issue with making arrests. I need it again.
I think we can shoot from the hip, Charlie.
I know.